What causes type 2 diabetes? Type 2 diabetes occurs when the body doesn't use insulin as it should, or when the pancreas doesn't make enough insulin to ferry glucose out of the bloodstream and into the cells. Instead, the glucose builds up in the blood, resulting in high blood sugar. When your body can't use insulin properly, it's called insulin resistance. Insulin resistance is responsible for most cases of type 2 diabetes. Scientists don't know why cells in the body become resistant to insulin, but it's clear that certain genetic and lifestyle factors play a role. Here are the most common. Your genes. Type 2 diabetes tends to run in families. Scientists haven't pinpointed the gene or genes responsible for insulin resistance. But even if you inherit certain genes that amp up your risk, it doesn't mean you will go on to develop type 2 diabetes. How you live your life also affects your risk. Your race. Certain racial groups, especially African Americans, Latinos, Native Americans, and Asian Americans, Pacific Islanders, have a higher risk of developing type 2 diabetes than white people. Your lifestyle. There's nothing you can do about the genes you inherit. But you can control how you live. Being overweight is the main risk factor for developing insulin resistance, especially if you carry that extra weight around your waist. Being sedentary, smoking, drinking too much alcohol, and consuming a high-fat, low-fiber, sugar-laden diet can all increase your type 2 diabetes risk. You can reduce your risk by adopting healthier habits. Your existing health concerns. Other medical issues that can increase your risk of developing type 2 diabetes include having prediabetes. Prediabetes means having higher than normal blood glucose levels but not high enough to be diagnosed with type 2 diabetes. People with prediabetes who don't control the blood sugar can go on to develop type 2 diabetes. Having gestational diabetes. Women who have gestational diabetes have elevated blood sugar levels during pregnancy and are at higher risk of developing type 2 diabetes later on. Moms should be tested 6 to 12 weeks after giving birth to screen for the condition. Having another condition linked to type 2 diabetes. Polycystic ovary syndrome, for example, affects women's sex hormones and is associated with an elevated diabetes risk, as is a history of heart disease or stroke.